Dr. Kevin Kavanagh is a retired physician and founder of a national organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
How are you today?
Oh, very good. Very good.
Glad to hear it. All right, let's see. Let's start with some good news. We're always full of bad news. So give us something to be encouraged about.
Well, there's actually two bits of really good news, at least I think. One is Regeneron's monoclonal antibody product has additional results out, and they're also very stellar that when given early, and this was to 524 patients, there was a 57% decline in medical visits. So that is really good. And they followed those patients for about 30 days after treatment. Again, we're seeing study after study showing good results with the monoclonal antibodies. So this is really the treatment that I am hoping will become very available in the near future. Let's just hope these companies can gear up production fast enough. The other thing that I think is very interesting to talk about, and this is kind of going full circle, is a commentary that was published in The Lancet, which is a very prominent medical journal, that talked about the risk of transmission of COVID-19 by fomites. Now, fomites are not bugs in your kitchen. They're actually any object that you can touch. For example, packaging, mail, groceries, things like this. And he gave a good explanation and also argument that maybe this virus only lives a couple of hours, that all of these other studies had such a high viral load that they were giving really false results. And all I can think of is early on, the WHO was saying, well, maybe this virus lives a day, maybe 2 days. We then had reports of 9 days, of 14 days. We back down to 5 days, and now we're kind of going full circle again with at least one scientist in a very prominent editorial board of the journal, which would have to approve the paper, stating that, well, maybe this will only live a little bit. So this is a big boost saying that there may be increased safety to doing takeout, pickup, home delivery, etc., etc. That doesn't mean you shouldn't be cautious. It's always wise to be on the side of safety. I still wash my hands thoroughly after packaging and are careful with the package. But on the other hand, it's good news on trying to get back to a modicum of normality with our lives.
Well, good. That's a good way to start. Now, the bad news is we're setting all kinds of negative records in Kentucky, aren't we?
Well, we are. And believe me, that's very discouraging. We have heard a lot that, well, rising cases is just increased testing. And of course, increased testing can cause rising cases, but rising cases can also cause the increase in testing. So you have to really look at other factors, like has the testing changed any in this time? What are hospitalizations doing? What are deaths doing? And unfortunately, those latter two metrics of hospitalizations and deaths are starting to, well, not starting, I mean, they are going up in Kentucky. Hospitalizations, we had 969 people in the hospital with COVID-19. We had a 6.04 positivity rate on our testing, which is way up. We were down in the 4.5 range at one point. And to me, this is very, very concerning. If we run out of hospital beds, the fatality and lethality of COVID-19 will go out the roof. And I know they're setting up field hospitals, but when I say hospital beds, I mean staff beds with trained people. And it's the trained frontline workers which are really the problem. And so, Jack, this is discouraging.
Now, you've sent me information, as you're always very good about, and I'm particularly interested in this kind of day-by-day. 2/3 of Americans, 68% report wearing a mask at all times, and we can't get away from this mask-wearing thing because it's important, and yet so many people are so resistant to it, and it just amazes me. But 2/3 of Americans, 68% report wearing a mask at all times when leaving home. Half, 51%, report maintaining a distance of 6 feet from others at all times. And that's great, but that still leaves a pretty big number of those that clearly aren't. I was in Walmart the other day, and it dawned on me that the people that are not wearing masks are the ones that stand out, not the people that are wearing them. And there are people that are checking you going into the store to make sure you're wearing them. But there was a couple that was shopping in there that didn't have masks. And I didn't say anything to them, but I think that in stores, especially those big stores, they need to have some folks out on the floor that are insisting that people wear their masks, don't you?
Oh, I agree. And the masks have to be worn properly. You want to have a good mask that's been constructed and well fitted. I usually carry a little pocket hand sanitizer, so if by chance I do touch my mask, I can reach in my pocket and clean my hands. So I think all of that's important. And you need to remember that this medical excuse for not wearing masks is, I mean, I hate to say it, but it's pretty much bogus. It is extremely rare to have a medical condition where you can't wear masks. Usually at that point, you're an invalid. If you have a medical condition that prevents that, such as bad lung disease, you should not be out in public, because if you get COVID-19 during this surge, your chances of survival are minimal. So basically, if you can't wear a mask, you should be sheltering at home during this surge. And again, there's extremely few people that can't wear a mask. I was an ear, nose, and throat doctor, Jack, for approximately 30 years. I dealt with respiratory problems all the time. I've never seen a person that couldn't wear a cloth mask. We're not talking N95s here, just a cloth mask. So please do that and wear one that's well-fitting and stay socially distanced. Remember, this virus can aerosolize. The mask does not prevent infection. It just makes it less likely by a factor almost of 6. So that means you still have to social distance. So the 51% of people who are social distancing, that's far too low of a figure, far too low.
I was in another store, not a grocery store, but another retail establishment, and I was in there for a while, and every 10 or 15 minutes, they came on the loudspeaker and said, please wear your mask and to do it properly and make sure it's over your nose, and if we notice that you're not wearing it properly, we will ask you to leave the store. And I was impressed that they would do that. Here's a text from our auto tech service text line, then we'll take our break. Are deaths and hospital stays going up by same rate as the cases?
Well, I've been looking at that, and I'll tell you, the hospital rates are, the deaths are not. But remember, deaths are lagging indicators. Sometimes it takes 2 to 3 weeks for a person to pass on after being in the hospital. This is a very slow, progressive disease. And also, our ability to treat patients is improving. And I've talked about this before, that as you get better and better at treating a disease, patients who are severely sick won't die. I mean, we have remdesivir, we have steroids, we know to anticoagulate patients, we know about proning, we have monoclonal antibodies, but they will still become very sick and sometimes can have chronic disability. And this is what we're seeing with COVID-19. So death is probably not a good metric to see how the epidemic is progressing, at what rate, but it is a very telling metric because, believe me, the number of Kentuckians that have died, over 1,400, is just a tragic thing to have happened.
Got a bunch of auto tech service texts here that we may or may not get to, but we'll try, Dr. Kavanagh. Someone has sent a picture of a box of masks. On the side of it, it says warning. This is just a portion of the warning. It says, will not provide any protection against COVID-19 or other viruses or contaminants. Now, when you see something like that, it makes you scratch your head.
Well, yeah, I mean, that's ridiculous. The CDC has a long list of articles that have come out. Some of these are recent research that have shown otherwise. I mean, it's absolutely false. It will protect others more than it protects you, but it certainly will protect you also. It will give you a layer of protection. As I've said before, to be completely safe, you have to wear goggles, you have to wear a hazmat suit, you have to know how to take this on and off. That's called donning and doffing. So all of this needs to be done, but a mask alone will provide the wearer with some protection. But it's very good at providing other people protection if you're an asymptomatic carrier. And for example, many people are asymptomatic carriers. This is probably between 40 to 45% of those infected, especially the younger generation. The younger you are, the more likely it is you'll have an asymptomatic infection.
And this leads to the next question that is here on our Auto Tech Service text line. It says, if you are wearing your mask, why worry about what I'm wearing?
Well, from what I've just said, the mask is more efficient at preventing another person from transmitting the virus to me. Well, it's ideally not designed for, but that's what it does. And that's why ideally we should be wearing it, is for caring about other people. Because if you're an asymptomatic carrier, this is what's important. I mean, there was an article out that shows close to 70% of grocery workers were asymptomatic when they had the infection. And this is a big number. So again, they need to wear a mask to protect others. That is why wearing a mask is so important.
All right, here's another question that goes right along with this on our Auto Tech Service text line. I do outside sales to businesses, so go to many small businesses. I always wear my mask. Only about 35% of owners and customers are ever wearing their mask.
Yeah, and that's problematic. I mean, it really is not a good thing to have happen. Unfortunately, Kentucky is, I think, behind the rest of the nation. I get reports of much better mask compliance in other areas, including red states. I mean, this isn't a Democrat versus Republican issue. It's more of a believe science and public health in your doctors versus not. And it's very unfortunate.
We've got about 20 seconds left. Leave us with some information before we have to go.
Well, I think the best thing is that we are knowing more about this virus. Another bit of good news was that there was an article out that shows that airlines and airplanes, because of their airflow, is really something that doesn't transmit a virus as nearly as much as what would be expected. They're fairly safe, and so we need to pay attention to airflow and air quality.
Have a good weekend. We appreciate it very much.